Hi, I'm Tim Kerns, Director of Maryland's Highway Safety Office, and I wanted to take a few minutes today to provide you a little background of highway safety in the United States and Maryland's Strategic Highway Safety Plan and how we're working to reduce fatalities and injuries in Maryland, both over the past decade and moving forward into the next decade. One of the things that we try to make sure that we do is we continually update and modernize our programs. The National Highway Traffic Safety Administration regularly puts out a manual of countermeasures that work. There are different programs and different activities that you can do in highway safety that will help reduce crashes, fatalities, and injuries on our nation's roadways. And the reason that that manual is continually updated and the reason that we continue to change and update our programs is that we need to change with the times. We need to change with our population. We need to change with the drivers that are on the road. So we can't just continue to maintain the status quo and expect things to change. We need to adapt as well. And that's why we develop highway safety plans to help us to do that. Just taking a look in Maryland over the past 60 years now, you can see we started when we were recording a number of fatalities in Maryland, 511 back in 1960. Over the course of the next 30 years or so, those fatalities went up to a high of 872 in 1968 and a low of 443 in 2015. We've also highlighted on there different things that have happened both in Maryland and across the country: the development of a trauma center, passage of GDL and tougher DUI laws, the implementation of airbags into vehicles, pretensioners, the improvements of engineering in not only the fleet, but on our roads as well, passage of laws that require everybody in the vehicle to wear seatbelts, and the development of highway safety plans where states take a comprehensive approach at reducing fatalities and injuries on their roadways. Over those past 60 years, and one of the key things to track, in addition to the number of fatalities, is the fatality rate. The fatality rate is determined by the number of fatalities that occur in a state or in the nation divided by 100 million vehicle miles traveled. So the more people that are out on the roadways, the more exposure you have, the more likely you are to be involved in a crash that could lead to an injury or a fatality. And you can see that over the years, the fatality rate has declined rather substantially from 6 in 1956 down to just over 1 in more recently. Some of the factors that have played into this: development of interstate highways back in the late 50s, the Highway Safety Act of 1966 that I will talk a little bit more about in a minute. It led to the development of NHTSA and our highway safety programs. NHTSA developing federal motor vehicle safety standards, which are the regulations that car manufacturers follow, the inclusion of airbags, when they depower the airbags, stiffness of door panels, the different things that rulemaking has required lawmakers to implement to make the vehicle safer. In 1975, we passed the 55-mile-an-hour speed limit. That has since been rescinded, so speeds are back up on a variety of roadways. In 1980s, MAD was begun, child safety seats and seatbelt laws went into effect. 1990s, the Buckle Up America program, the Buckle Up America campaign. Airbags were introduced into the fleet in the early 90s. They have changed over time. Not only have airbags, the force with which they are deployed, but also the number of airbags in the car. They started out with just the driver. They advanced to the passenger, and now there's side airbags, there's rollover airbags, there's airbags in lots of places in your vehicle. The Click It or Ticket campaign was started in 2000s based on a program in North Carolina. In 2012, the FAST Act, which is the current legislation that provides funding to support our highway safety programs. That was passed in 2015. That legislation expires at the end of September of this year. So now we're looking forward to what the next highway authorization will look like and what the funding will be directed towards and how much money will be available. The Highway Safety Act of 1966 established uniform highway safety programs across the country. It provided funding. It was a carrot on a stick approach. So if you passed certain laws or if you added certain regulations to your state, you were eligible for more funding from the federal government. So eventually there were 18 program standards in all. They range from motorcycle safety to EMS to crash investigations, driver education, occupant protection, traffic records. There are a lot of programs now that fall under the Funding Act. As I said, the FAST Act, the Fixing America's Surface Transportation, was enacted December 4th of 2015. We are currently in the last year of that, and what we expect to see is a continuing resolution of the FAST Act, at least through the end of the year, maybe into the beginning of 21, while Congress works on developing the new authorization. There have been drafts out. I know the Governor's Highway Safety Association is working closely with members of Congress to include language that would help states with their flexibility to spend money on highway safety programs and to improve the highway safety programs that we have. The federal monies that are part of the authorization come from several different sources. Gas taxes, a tax on tires, and taxes paid by commercial vehicles as they travel the roadways. The gas taxes, as you can imagine, have the revenue from those has decreased recently or over the past decade or so as vehicle miles, the economy has improved with the vehicles, and you can get 50 miles to the gallon. We've introduced electric vehicles to the fleet, so gas taxes aren't generating as much revenue as they have before. So what you'll see as Congress works through the reauthorization, they also have to determine a way to re-up the Transportation Trust Fund, which is bordering on not being solvent in the next 5 years or so. National incentive programs developed by NHTSA include occupant protection, impaired driving, traffic records, motorcycle safety, distraction, younger and older drivers, and pedestrians and bicyclists. You've seen these advertisements in Maryland. We've used the Click It or Ticket program. We've used Checkpoint Strike Force. We've implemented a number of these campaigns as provided by NHTSA to help support and to help get the word out about enforcement and education campaigns. The MHSO, or the Maryland Highway Safety Office, is the state's designated highway safety office. We provide a variety of state and federal grants. I think during the current grant year, we've provided about $11 million to our partners to support a variety of activities, including enforcement and education programs. We have 4 sections in our office. They're broken up through outreach, finance, law enforcement, and safety programs, and I'll talk a little bit more about those. The Motor Vehicle Administrator, Chrissy Nizer, is Governor Larry Hogan's highway safety representative, and she oversees all the highway safety programs that go on in the state. As you can expect, the mission of the Maryland Highway Safety Office is to save lives and prevent injuries by reducing motor vehicle crashes on the roadways. And we do that through the implementation of a network of traffic safety programs that are largely done through the cooperation between our staff and our highway safety partners. Just to give you a little bit of background about who we are, the Law Enforcement Liaison Program, we've divided the state up into 4 different regions. So we have Western Maryland, Central Maryland, Southern, and then the Eastern Shore. We've divided them up this way so the law enforcement liaisons and our outreach team can work together. So whether they're dealing with local law enforcement agencies and helping to support their activities, to give them data and information to where they can best apply their resources, or whether it's working with employers or schools to get an education campaign out, whether it's working with the local SHA districts to combine education and enforcement campaigns with engineering changes that they will make. If they install, for example, a hawk signal to improve pedestrian safety, we want to be able to back that up with enforcement and education, able to get that message out and to make that program work more effectively. Our outreach section, the Regional Partnerships, Resources, and Outreach Program, we call them the PROs. So as I said, they're divided up into the same regions as the law enforcement liaisons, but they focus more on working with the SHA districts, with the school systems, and with employers to provide resources, information, and background to support their campaigns, to support any programs that they have, and where they're looking for programs to be able to provide them as well. Statewide, we have a variety of highway safety programs that focus on different emphasis areas. So from aggressive driving to impaired driving, occupant protection, pedestrian and bicycle safety, and then data that kind of oversees everything. So these program managers kind of oversee the statewide perspective of what we're doing with our highway safety programs. And of course, all these programs, as you will hear if you hear a NHTSA presentation, everything that we do, we try to use data to guide what direction we take, and we try to use data to measure the effect that we're having. If we can't understand it, we will not be able to prevent it. So that's what we try to use the data for. When we talk about data, we're not just focused on crash data. We're talking about all highway safety data, which in addition to crash data, includes data from the court system, injury prevention data from hospitals and medical examiners' offices, EMS data. We want to make sure that we are able to include the roadway data from our state highway partners and driver and licensing data where it's possible from our Motor Vehicle Administration as well. Highway safety data, as you can imagine, is used by a large number of people in a variety of different disciplines. I'm not going to read through all of these, but you can see that a lot of people rely on highway safety data not only to implement their programs, but to evaluate their programs and to use it as to identify where their programs are. Talking about that a little bit, we do utilize data for problem identification because we can use the data to show when we're looking at crashes, where they occur, when they occur, who is involved in them, and often we can identify a little bit about why they're happening. And if we can do that, it improves our ability to be able to predict where crashes happen, and that can help improve our interventions. We have the opportunity to partner with some of the universities in the state. For example, Washington College and the National Study Center have been longtime partners. They focus on slightly different aspects of highway safety, whether it's from providing maps or if it's providing just data analysis using highway safety data. This is just an example of a map that goes way beyond what we used to use with just general pin maps where you would be able to put in where the crashes happened. You can now look at add different characteristics. You can add roadway characteristics. You can have area-wide characteristics, so you can see using Google Maps. You can pull that kind of information in to see if it's built up in an area that really the roadway really hasn't caught up with the infrastructure. So you want to add crosswalks, or you want to identify places like that. You want to identify corridors where there are high volumes of crashes or a high rate of crashes. So you can work with both the engineering and enforcement partners to improve those areas depending on what problems you identify there. We're also able to use statewide data and crash data to look at trends and targets. So this is just an example of being able to take a look at what our fatality trends have been over the past decade and a half. We're on a very nice trend up until about 2014 when they've started to go up recently. We also use this information for targets. As part of our reporting back to our federal partners, we're required to report on fatalities, serious injuries, and pedestrian fatalities and their rates as part of our measurements, as part of our performance measurements that we track. We use the data to give us the targets that we want to aim for. So that's why you see a lot of equations on this graph. They're there to help us to set targets that we can work towards. So when we're telling Federal Highway or when we're telling NHTSA, these are the goals we want to set for ourselves, we are looking to reduce the number of fatalities on our roadways. One of the things that we can see in using the data is that majority of crashes and fatal crashes do have some sort of human error component. So when we're talking about looking at enforcement and education, those categories on the right-hand side of the screen, the speeding, the belt use, distractions, those are all things that can be affected by the programs that the Highway Safety Office puts together. Whether it's from us providing education programs about the dangers of not wearing your seatbelt, the dangers of driving while impaired, or whether it's working with our law enforcement partners to provide a different sort of education message that if you do not wear your seatbelt, you will get a ticket. And hopefully there's kind of a reinforcement message by combining both of those together. In Maryland specifically, 64% of our fatalities over the past 5 years were related to 3 program areas, and that would be speeding, impairment, and belt use. You can kind of see the Venn diagram there about how they all fit together. And there were 63 fatalities over the past 5 years that were unbelted, were speeding, and were identified as being impaired on the crash report. Additionally, Maryland's seatbelt use rate was 90.4% in 2019. That 10% that do not wear their seatbelts is an elusive target, but is one that we continually strive to reach. Those are the ones that are putting themselves at a little bit more risk when they're on the roadways. Seatbelts are 50% effective, roughly, at reducing fatalities if you're involved in a crash, at preventing fatalities. So the more people that we can get buckled up, the more lives we can save. And you can imagine that risk factors often cluster together. So when we're reaching out for those people who are not wearing their seatbelts, we also want to make sure we're reaching those who are texting and driving, or using their cell phones, or putting on makeup, drinking, and driving aggressively. We want to focus on all of those areas. And because crashes, we believe, using the data and using the information that we have, that we can anticipate that they will happen or how they will happen, and we can change them, we can intervene, and we can introduce countermeasures that will prevent them from occurring. We cringe a little bit when we hear people talk about them as accidents. Crashes, we believe, are both predictable and preventable, so they are not accidents, they're crashes. Accident gives a little bit of out for somebody who talks about being involved in a crash. Accidents widely have the perception that there was nothing that you could do to prevent it. We believe that there is. So we try to encourage all of our partners to use the word crash when they're talking about a motor vehicle event. One of the things that we are trying to do with our programs, though, there is a Swiss cheese model of causation. So you can kind of see that when all of the slices of the cheese line up and all the holes line up with all the factors that could be involved in resulting in a motor vehicle crash, the perfect storm hits and the motor vehicle crash occurs. What we try to do with our programs, whether it's working with any one of our partners, whether it's education, enforcement, engineering, or EMS, is we try to change, just rotate any one of those slices a little bit. Because as long as we can prevent all those holes from lining up, we can prevent the crash from occurring. And it doesn't really matter which slice of cheese we're able to affect. As long as we can affect one, we can improve highway safety by reducing the number of crashes. I talk a little bit about fatalities, but just so you know, fatalities are just the tip of the iceberg. While we see over 500 or approximately 500 fatalities per year, in Maryland, there are over 3,000 suspected serious injuries. And the serious injuries obviously require more extensive medical care. They're more costly. They can be more life-altering. But even less serious injuries can also change a person's lifestyle. If you have an ankle fracture, for example, and you were an athlete or you worked on your feet all day, even that minor of an injury can kind of alter how long it takes you to get back to work, how long it takes you to get back on the field. So all injuries that we can prevent will be beneficial. This is just a little bit of a breakdown of the last 10 years or so. So the fatalities and the fatality rate. Overall, we've trended downward, which is a good thing. Fatalities, though, have been a little bit reluctant after 2014. They went back up, and they've been a little reluctant to come down back below 500. As I showed earlier, fatalities in 2019 were 530. Serious injuries have come down at a little bit of a better rate. I show this because this is one of the measures that we do report to NHTSA and to Federal Highway. However, changes in reporting a little bit. Maryland changed their crash report from a paper-based form, now it's electronic. We've also, working with the National Highway Traffic Safety Administration, have modified the definition of what a serious injury is, trying to make it more standardized across the country. So while fatalities are much more easy to count than serious injuries, we're trying to do the same thing with serious injuries because that is obviously a bigger piece of the pie. In Maryland, there were 6 times more serious injuries than there were fatalities. So they're better numbers to not only track, but to see how your campaigns and how your efforts are helping reduce them. One of the things that is contributing to our numbers of fatalities, staying above 500, even though you did see on the earlier slide that our rate has slightly come down, is increased in exposure. In 2019, there were over 3 trillion miles traveled on United States roads. In Maryland's portion of that in 2019 was 60.2 billion. That was up a little bit from 2018, and it's over 2.5 billion miles traveled than just 5 years ago. So there are more cars on our roadways. There is more opportunity for interaction between cars, and not only between car versus car, but car versus bicycle or car versus person. One of the issues that we have is that, and you've seen it in action this week, these past few months, there are many traffic-related issues that compete for our attention. So I talked a little bit about what our emphasis areas are, but there are a lot of other highway safety topics, and you can see many of them listed here, that all require a little bit of attention. So focusing on one area is difficult. You have to have a comprehensive approach. But not only are traffic-related issues taking up our attention, but there are many health-related issues and many other issues that are competing for our attention as well. So you can see that there is a lot of stuff going on that kind of can divert your attention from focusing on just motor vehicle crashes, and we have to work within all of our partners to make sure that we're still getting our message across and we're still able to work with them to implement our changes. So to get us there and to reduce the number of fatalities, because we need to have a target to aim for, and we need to know where we're going. So Maryland's path forward is the development of a strategic highway safety plan. And the first version of this plan was back in 2011. It was updated in 2016. It was kind of revamped. And we are now currently in the process of putting together our 2021 to 2025 statewide strategic highway safety plan. The image on the right talks about the 4 key components that are crucial to highway safety, and that's combining enforcement, engineering, education, and emergency medical services. I've mentioned those a couple of times. Our emphasis areas are in blue around the center. So it's aggressive and distracted driving. We do have a focus on highway infrastructure and engineering, impaired driving and occupant protection, and pedestrians and bicyclists. So those are our current emphasis areas, at least through the 20 plan. We're not planning on changing those drastically for 21 to 25. And I'll explain a couple of reasons why moving forward. So we kind of want to keep our target emphasis areas, and we want to make sure that we maximize the coordination and collaboration and communications between us and our partners. As I said earlier, everything that we do is built on data. So the data system components down there are what are typically referred to as traffic record system components. So we use all of that data to support all of these programs. For the past 10 years, the objective Maryland was towards 0 death state. So we were focused on reducing the number of fatalities and serious injuries in half by 2030 using 2008 as a benchmark. If you followed the Maryland State Legislature last year, they did pass a bill that focused more on a Vision Zero program for the Department of Transportation. So we have incorporated the Vision Zero program and goals into this upcoming strategic highway safety plan. The Vision Zero goals, if you're familiar with the program, are 0 fatalities and serious injuries by 2030. That's a pretty aggressive program, but it is definitely something worth striving for, because even one fatality on Maryland's roadways is too many. Talking a little bit about Vision Zero, and I mentioned Towards Zero Deaths, there are other zero programs out there, whether it's Target Zero or whether it's Road to Zero from the National Safety Council. Target Zero is a Washington State program. There's lots of discussion about whether these programs are competing or they're collaborative. They are all moving in the same direction. They all have a slightly different approach to what areas they focus on. We will continue to use our comprehensive approach, focusing on each one of the 4 E's, engineering, enforcement, EMS, and education, because we believe that it takes all of those components working together to get us to zero. There are some things that will be more difficult to change. Some things require a lot more infrastructure changes. We need to make sure that we work within the structure that we have. So we want to be able to continue to improve roadways. We want to continue to improve our educational efforts, our enforcement campaigns. We want to reduce response times for EMS. We want to make sure that they have the information that they need and that they're safe out there as well. So we want to make sure that we combine all these efforts in reducing them. So in effect, we are combining all aspects of all of these programs. We are trying to get to zero, and that is our ultimate goal. But zero is a pretty aspirational goal, especially over the next 10 years, when you've seen that the past 5 years, we've been hovering around 500. So just to share some man versus food challenges, most of these are within the region. So if anybody is hungry and wants to look one of these up on the internet, I'm sure they will be happy to serve you and give you the opportunity to tackle one of their challenges. But how do you do that? If you go to Dover Downs and have the Monster Burger, how do you attack that problem? Well, it's one bite at a time. We are not going to get to zero overnight, and you're not going to eat the Monster Burger in one bite. So we have to address it one bite at a time. We have to take off pieces that we can take on challenges that we can address, set interim targets that we can hit, and work our way down to zero. So how do we get to zero deaths? Well, our plan is to use the Strategic Highway Safety Plan approach. As I mentioned, and I think I bring this up again, each one of our actions, each one of our emphasis areas has a set of strategies, whether it's combining data or engineering efforts, enforcement efforts, and under each one of those strategies, there are action steps. I've mentioned the 4 E's before. Here's a little bit more of a breakdown of them, but these are our overarching strategies that we will use in both individually and in combination to get us to where we want to go. Often it's combining these 4 component systems to give us the best combination of countermeasures that will work and that will reduce our fatalities and serious injuries. But to do that, we are working towards developing a safety culture, and it's not just on a statewide level. We support, and our State Highway Administration is supporting the development of local SHSPs, because as you can imagine, the statewide plan needs to be fairly broad and needs to cover a lot of territory. But what works for the state level may not necessarily work for a local municipality or a local subdivision of the state. We want to encourage those developments of the plans. If you want to use the Maryland overall foundation, that's perfectly fine. We'll support you with that. We'll be able to support you with data. We'll be able to support you with suggestions for programming. We worked well with the Baltimore Metropolitan Council, who have put together a group that works with their member jurisdictions to be able to help develop strategic highway safety plans for each of them, and we encourage other jurisdictions to follow along. If a local jurisdiction wants to go their own way and they look at their data and they focus on different emphasis areas, that's fine, because any success that they have at driving their numbers down, we'll drive the statewide numbers down as well. So we are supporting in every way that we can. Each one of these plans will have a different combination of considerations and strategies, whether it's focused on runoff road crashes, intersections, work zones, or different types of behaviors. We can work with the jurisdictions like we do on the state level, working with our partners, and there are varieties of programs that can be used to address these categories, whether it's through education or enforcement or engineering. And like I said, we want to merge all these together. Our strategies lay one on top of the other. So we're not focused on just using enforcement. We're focused on using each component as best we can to maximize our efforts. I know you've heard a lot about public health over the last 3 months or so, but it's important to realize that highway safety is also a public health problem. These questions on the left are pulled right out of what you ask about public health. They're the same questions that can be asked about highway safety. We want to identify the problem. We want to identify the causes behind it. We want to know the countermeasures that work to prevent it or to at least mitigate it. And what steps do we need to take? And then at the end, we want to make sure that we can evaluate our programs and make sure that what we've done is effective. And as I said, we want to build that traffic safety culture that pulls all of these pieces together, because it's only through this integration and pulling all these pieces together that we'll be successful in our endeavors. I mentioned a little bit earlier about local strategic highway safety plans. There are 5 counties in Maryland that have already pulled their plans together: Cecil County, Washington County, Prince George's, Hartford, and Montgomery. There are several cities. Salisbury just adopted their plan. Howard and Carroll have plans well underway. Baltimore County is also interested. As we move forward and there are more opportunities for collaboration, I think we will see more interest in developing local strategic highway safety plans throughout the state. So we're looking forward to working with them. And as I mentioned before, all of those individual action plans as well as the statewide plan have strategies that have action steps that support them, and evaluation and performance measures that we can track our success. So as we work through the next plan and as action steps are completed, we can show that using performance measures that we've achieved the goal for that action step. We can replace that action step with another. Our strategic highway safety plan will be a living document, so we will be able to continually make changes. We'll be able to continually update it and refine it as necessary. I know we've added some sections in the new plan that's under development. We're making sure that we have autonomous vehicles included. We're making sure that we have other vulnerable road use populations included. We have a number of rural counties in Maryland. We want to make sure that farm vehicles are addressed. We want to make sure that this plan is comprehensive, because as we develop our annual proposal to NHTSA, this strategic highway safety plan is the overarching umbrella that all of our programs need to fit in. So we want to make sure that we have gotten as much input as we possibly can. And kudos to the staff that I mentioned before and to some of our partners that have worked. They started putting this together after we started our stay at home. So these meetings were held virtually starting in March, and all this development has been through online meetings and conference calls, one-on-one phone calls, one-on-one meetings. They've done a lot of work to help put this together, and we look forward to presenting a draft to our SHSP executive team, which will occur in July. We look to have the final SHSP approved and ready to hit the ground running in January of 2021. But why do we continue to do this, and why do we need to make this plan as comprehensive and as successful as possible? These are just some headlines pulled from the paper over the past several months. I'm sure you've seen on the news that we've still had a rash of speeding crashes. We've still had some crashes out there, even though our volume of traffic has reduced significantly over the past couple months. It is just now starting to head back towards where it was back in February, but we are still about 25% low on volume on Maryland's roadways. but we still continue to have crashes. There are still crashes. These crashes are still affecting people's lives, and they are, still, we still need to, we still have a lot of work to do. Over the past quarter, these are just some pictures of what we've been able to do. This is the fourth quarter of 2019. So whether it's working with law enforcement and education from mock crash that I know Chesapeake Regional Safety Council has been involved in putting a couple of those on. We have a rollover simulator that we will be getting wrapped very soon that will be available for presentations and as a good educational tool for seatbelt use. We've worked with local programs, the Calvert Alliance Against Substance Abuse. We've worked with Baltimore Metropolitan Council to develop Look Alive pedestrian safety campaign, awards for law enforcement officers, impaired driving awards, and Maryland Remembers, which takes place in November at the State House each year, or the governor's mansion. The pictures along the bottom are the reason that we do continue to do what we do. Each one of those pictures represents a life lost in Maryland. Each one of those persons were killed over the past several years in Maryland as the result of a motor vehicle crash. And they're the reasons that we keep doing what we do. And to make our program successful, it will take every one of us. It's not just the staff of the Highway Safety Office or our law enforcement partners. It's everybody out in the community. It's all of our partners, whether they're schools, law enforcement, community groups, advocacy groups. It will take all of us to work together to spread the message to reduce fatalities and serious injuries and crashes on Maryland's roadways. What will the next chapter look like? I did mention including autonomous vehicles in the Strategic Highway Safety Plan. The future is going to include a lot more of that. They are not coming as quickly as you might have heard about a decade ago. They are not all over the fleet yet. They do have lots of new cars have some driver assist functionality, but they are not taking over for us yet. So as long as we still have a human being behind the wheel, we still have a lot of work to do for education and enforcement and engineering and EMS. We still have to focus on those four components. And I know that there are a lot of other programs that incorporate other E's, and those E's are important as well. And we pull those in every opportunity that we have, equity and evaluation. And we do want to make sure that those are all components of our plan. We want to work with everybody, and we want to develop a highway safety plan that will work for everybody. So we invite you to join our journey. Sorry, we invite you to join the journey towards zero deaths and to get us to a vision of zero deaths in Maryland in the future. We are online and on social media. Please feel free to add us to any of your social media accounts. We would be happy to have you follow us. We do have a webpage, zerodeathsmd.com. We've had a seminar series since we've been out of the office. We've been able to keep in touch using a variety of presentations, calling in a number of different partners. Those presentations are all available up on zerodeathsmd.com. Just follow the resources link and you will be able to find them. If you have any questions, my email address is up there. Please feel to reach out to me. Please feel free to reach out to any of our partners or any of our staff or our section chiefs. Their emails were all listed earlier in the presentation. We will be happy to help you in any way you can, and we look forward to continuing our partnership, and we look forward to working with you in the future. Thank you very much for your time. I look forward to hearing from you if you have any questions, or if there's any way that the Highway Safety Office can help you develop your highway safety programs. Thank you for your time.